Hello, my name is ABIENVENU, and today we're going to talk about documenting medication response and the importance of it. So, for let's just say for PRN or pain medicine, we're going to use this scenario. For pain medications, you want to see when's the last time it was given. So you pull up your MAR. If the patient's complaining they need pain meds, let's pull up the MAR, see when the last time it was given. It's because there's a certain window, the amount of dose you can allot in that window. So we say we look at the MR and we're able to give the medication right in there. So we need to go in and we need to make sure that this is the right dose, right person, all your 6 checks to make sure safety for the patient. Um, Now, before you give that medication, you want to ask the patient, depending on their age, of course, but use a pain scale. If they're, say, 50 years old, obviously you're going to do a 0 to 10 pain score. They can communicate with you and they're not unconscious. They are talking that it's hurting. So we're going to do 0 to 10 and the patient says 10. Okay, so we're going to put 10 down. We're going to document that in the chart as well. Ask them that what makes the pain a little more or makes it worse, whether it be activity, movement, or if it's just hurting, just not doing anything. And ask them if the pain is radiating anywhere else. See if they're having wrist pain, but now it's going up their arm, or it started here, because the pain may be it may be a sign that something else is going on. So definitely document all these deals. You also want to, with pain, you want to do a follow-up. Say you administer the medication and you want to follow up, say 30 minutes or whenever the onset of the drug is, and ensure that the pain medicine is working. Before, say you want to make sure, before you get the pain medication, you want to make sure that all the vitals are within normal limits. Sometimes with extreme pain, obviously some vitals would be higher, but if the respirations are 8, you don't want to give a morphine or something that not cut the respirations. So a lot of these things go in effect when you do pain medications, and documenting all of these responses to prevent yourself from error that could potentially be made, or a future nurse. If you don't document it, then in theory it was never given. It never happened if it wasn't documented. So to protect your patient, make sure that you are always documenting the correct dose, the times, the intensity of the patient, the prior the medication, 30 minutes after, and your follow-ups. Make sure, and the same thing goes for any medication. Insulin, you're going to give it to them. You're going to test your blood sugar first, then you're going to give the medication, and then you're going to do a follow-up. All these things need to be documented so that you can see a trend of how the medication is working effectively. If the patient is saying at 8:05, 10 out of 10, you give the medications 30 minutes later, and it's still 10 out of 10, obviously that medication isn't working for that patient. Something else could be be prescribed, or there's an underlying cause, a more serious underlying cause taking place that we need to address. More of a focus assessment now at this point that it's not getting better, that there's signs still. That is the importance of documenting, and documenting is all you have for the future for protecting yourself. Say if something happened to a patient and you have a court hearing for something, say a person is suing the hospital, you're not going to remember every single patient. You may remember significant patients in your life, but you're never going to remember every single patient and the amount of drug you gave them. But you will always have your documentation to fall back on in case that comes up. You can go back in the records and look exactly how much medication you gave to protect yourself and protect your license. My name is ABIENVENU, and that is everything for documenting medication responses and the importance of documentation. That is everything. Thank you. Have a good day.